The State Department of Health is now spearheading the effort to create a new OB system of care aimed at saving lives and providing the proper level of care for pregnant women and their babies.
In part 2 of 911, Black Maternal Health Care Crisis, 3 on your side, Samantha German speaks with the state health officer along with health leaders in the Delta region about the issues they face when it comes to drive times during health emergencies and the lack of funding for rural hospitals causing many to close their doors.
3 a.m. July 5th. There's a awakening call, a beautiful mom, 4 days from delivery, and then a seizure. The call for 911 to the Humphreys County Sheriff's Department, and the call says the one ambulance for the entire county is already out on a call.
Forced to drive his pregnant wife, Harmony, Byron, a now desperate husband, rushed down Highway 49 south to the closest emergency room, roughly 30 miles away.
There, Harmony and Harper, 4 days from delivery, passed away. 3 miles from the nearest emergency room.
Pain from the podium. Representative Tamika James Jones shares her niece's story, which is tragically one many Black women in Mississippi can relate to. In 2022, leaders at the Mississippi State Department of Health gathered data of drive times and distances from maternal residences to delivery facilities. They found major portions of rural areas in the state are not within a 60-minute drive of a birthing facility, adding to the haunting fact Mississippi is one of the last states in the country when it comes to maternal and infant mortality rates.
More than 80% are preventable, which is tragic. So we're talking about pregnancy-related deaths, that if our mom had not been pregnant, she would not have died. And it's important to me that moms and babies don't die because of their zip code.
In the Delta region, due to the highly uninsured population, crucial departments, along with some entire hospitals, have closed their doors for good. Never turning away someone in need of care, providers in rural areas take on patients who can't afford health care, forcing hospitals like Delta Health System to come out of pocket.
We closed our neonatal ICU a few years ago. And the reason for the closure was multifaceted, but definitely cost inclusive.
Keel Holmes is the chief nursing officer at Delta Health System. She has witnessed one of their largest medical floors close and their ICU go down from 16 beds to 8, impacting the flow of the hospital.
When you downsize, it kind of puts a strain on our emergency department. So what we've seen, a lot of increased holding in our ER. So patients that have been admitted to the hospital can't go up to a floor, like to the bed, because there are no beds.
Holmes says Medicaid expansion would be an answered prayer. But in the meantime, through grants, health leaders are using programs like the doula training program and Rural Moms, which helps new moms with transportation, mental health, and even equipment to check blood pressure, glucose, and their weight.
Everybody knows we can't provide level 1 maternity and NICU support in every county in the state, but we can have a system that facilitates getting patients to the level of care that they need.
Dr. Dan Edney says they have been doing that since the 1990s with trauma.
If the trauma is too much, we evacuate them to a trauma center. And that makes perfect sense. That saved time, which has saved lives, and our outcomes have improved in those areas. I truly believe that if we build a similar system for high-risk maternal infant care, we'll see the same improvement, and that gap will close.
The Mississippi State Department of Health is now creating an OB system of care that would provide increased prenatal care opportunities and expedited transfers to appropriate levels of care for pregnant women in the state, trying to close the margins when it comes to maternal health disparities.
Harmony was my niece. Harper was my grandniece. Harper, who I never got to meet. Harmony, the songbird of the Mississippi Delta. Mississippi, we need to do better. Mississippi, we've got to do better.
An urgent call for action to ensure all moms are seen, heard, and have the birth they desire and deserve. Samantha German, 3 on your side.